Have you ever been right in the middle of an intimate moment only to have the penis suddenly lose its rigidity? It can be frustrating, confusing, and even damaging to your self-confidence if you don't understand the underlying causes. Yet you're far from alone. According to the Cleveland Clinic, approximately 52% of men experience some form of erectile dysfunction, often called ED, at some point in their lives. I'm Dr. Jen Gunter, and today I want to demystify why erectile dysfunction can happen during sex, explore the mind-body connections involved, and offer practical strategies for overcoming it. By the end of this video, you'll understand not only the physical mechanisms behind an erection, but also the psychological and lifestyle factors that can make or break your sexual experience. Before we dive deeper, I'd love for you to consider subscribing to our Healthy Sexuality channel if you haven't already. Simply hit that subscribe button and tap the notification bell so you never miss our latest updates. Your support truly means the world to us. And if you find this video helpful, please give it a thumbs up. It really helps share our message with a wider audience. I'm excited to hear your thoughts on today's topic. If you enjoyed the content, type yes in the comments below. If it didn't resonate with you, let me know by typing no. Your feedback is incredibly valuable and helps me craft videos that better suit your interests. Now, let's dig into the reasons behind erectile dysfunction during intimacy and what you can do about it. The brain and body connection. The first thing you need to know is that an erection isn't just a local, isolated event. It's the result of a complex interaction between your mind and your body. Your brain is the control center, processing stimuli such as touch, scent, sight, or even a specific memory that triggers excitement. It's similar to a well-coordinated orchestra. If one section is out of tune, it affects the entire performance. When these sexual signals reach the brain, the parasympathetic nervous system swings into action, promoting relaxation and sending more blood flow to the penis. Think of it like shifting your car into park. You're calm, not rushing, and the engine is primed to direct resources where they're needed. This redirection of blood into the penis causes the tissue to expand and harden, resulting in an erection. However, if the brain senses danger, stress, or distraction, it may slam on the brakes by activating the sympathetic nervous system, which is responsible for the fight or flight response. In this state, the body diverts blood away from the penis and toward major muscle groups and the heart, preparing you to run or defend yourself. The result? An erection that may never fully materialize, or one that suddenly disappears. Why relaxation matters. You've likely heard the phrase, mind over matter, and it definitely applies here. To maintain a robust erection, you need a mental space free from nagging worries, like overdue bills, looming deadlines, or an uncomfortable situation at home. Even small distractions can activate your sympathetic nervous system and short-circuit your body's natural relaxation response. For instance, if you're on the verge of intimacy and suddenly think about a stressful work meeting, you can instantly lose focus. This mental shift is enough to drop your body out of its relaxed parasympathetic mode and into the stressful alert mode, drastically reducing blood flow to the penis. It's one reason why couples often try to ensure a calm, private environment for intimacy. Any unexpected noise or disruption can break the mental spell and cause the erection to falter. Chronic stress as the invisible saboteur. Chronic stress is like a leaky faucet. A little drip here and there may seem harmless, but over time it wastes water and drives up your bill. In the same way, constant low-level stress can gradually sabotage your sexual performance. When your cortisol, the stress hormone levels, remain elevated for too long, you may find it more challenging to achieve or maintain an erection. For example, if you're dealing with financial pressure or family conflicts, you might bring those worries to bed without even realizing it. They hover at the edges of your consciousness, preventing you from fully relaxing. That's why addressing stress, from regular exercise to mindfulness practices or therapy, can do wonders for your sex life. According to the American Psychological Association, techniques like deep breathing, progressive muscle relaxation, or guided imagery can effectively reduce the body's stress response, potentially leading to improved erectile function. Health conditions that play a role. Sometimes, erectile dysfunction is a canary in the coal mine for more serious health concerns. Chronic diseases like diabetes and hypertension, high blood pressure, are prime examples. High blood sugar levels in diabetes can damage nerves and blood vessels over time, hindering the signals needed to achieve an erection. Meanwhile, hypertension contributes to hardened arteries, reducing blood flow and making it harder to sustain that firmness. In fact, the National Institutes of Health, NIH, notes that men with diabetes are up to 3 times more likely to develop ED. Medications used to manage these conditions can also be part of the picture. For instance, certain diuretics for high blood pressure may reduce blood volume or affect hormone balances, both of which are crucial for sexual performance. If you're on medications and suspect they're affecting your erections, it's important to discuss this with your healthcare provider. A simple dosage adjustment or a switch to a different drug class could help restore healthy function. The role of medications. Beyond blood pressure meds, a range of pharmaceuticals can alter sexual performance. Antidepressants are well documented for sometimes inhibiting libido or delaying orgasm. They modulate neurotransmitters in your brain, which are also involved in sexual response. Meanwhile, drugs like finasteride, used for prostate issues or hair loss, can reduce testosterone levels, sapping your sexual desire. This doesn't mean you should ever stop taking these medications abruptly. Instead, it highlights why open communication with your doctor is so important. If you're experiencing side effects, ask about alternatives or a lower dosage. Sometimes, even the timing of when you take a medication can help mitigate its sexual side effects. ED medications and responsible use. If you've experienced erectile dysfunction, you may be familiar with PDE5 inhibitors like tadalafil and sildenafil. These medications help relax blood vessels in the penis, increasing blood flow and making an erection more attainable when sexual stimuli are present. Some men prefer a daily low-dose regimen, like 5 milligrams of tadalafil, to maintain a consistent level of the drug in their bloodstream. Others prefer using it on an as-needed basis, taking a pill about an hour before sexual activity. Whichever route you choose, medical guidance is paramount. These drugs can lower blood pressure, so if you have cardiovascular issues or are taking other medications like nitrates, you need to exercise caution. Self-medicating, especially at higher doses, can lead to serious complications. Overdosing on these drugs can cause headaches, dangerous drops in blood pressure, dizziness, and in extreme cases, heart problems. Plus, they won't magically generate desire. An erotic or intimate stimulus is still required for them to work effectively. The danger of self-medication. Many men are eager to see fast results, so they ramp up the dosage on their own, mix PDE5 inhibitors with other over-the-counter supplements, or purchase questionable products online. This approach can be risky. Not only do you risk counterfeit pills that may contain harmful substances, but you could also be masking an underlying health problem, like heart disease, which demands proper medical attention. If you're tempted to experiment with higher doses without a doctor's oversight, remember that more isn't always better. In fact, an excessive vasodilatory effect can sometimes counterintuitively reduce the erection quality, leaving you worse off. Moreover, it can exacerbate side effects like severe headaches or sudden fluctuations in blood pressure. Always talk to a healthcare professional before changing how you use ED medications. Fine-tuning your treatment plan. Just as each person has different nutritional needs and exercise habits, there's no one-size-fits-all approach to treating ED. Some men respond best to a daily microdose of a PDE5 inhibitor, while others might require a higher dose less frequently. Your doctor might also explore other treatment options like vacuum erection devices, penile injections, or hormone therapy if low testosterone is found to be an issue. Sometimes, a combination approach is necessary, especially if you're also managing conditions like diabetes or high blood pressure. Keep track of any changes you experience, such as headaches or fluctuations in your mood, so you can report them accurately to your healthcare team. These details will help your doctor calibrate the right dose or treatment type. Lifestyle factors for stronger erections. Good sexual health is about more than just medication. Sometimes small lifestyle tweaks can dramatically improve erectile function. Here are a few. Prioritize quality sleep. When you don't get enough rest, your body's ability to produce testosterone and other hormones gets disrupted. Aim for 7 to 9 hours of uninterrupted sleep. A study published in the journal Brain Research shows that lack of sleep can decrease testosterone levels, directly impacting libido and performance. Stay hydrated. Dehydration can reduce blood volume and general energy levels, making it difficult for the body to maintain a strong erection. Drink water steadily throughout the day, rather than chugging right before bed. Eat a balanced diet. Foods that support heart health, like leafy greens, whole grains, lean proteins, and healthy fats, can benefit erectile function by improving blood circulation. According to the American Heart Association, a diet rich in fruits and vegetables is linked to better cardiovascular outcomes, which often translate into better sexual performance. Manage stress. Techniques like yoga, meditation, or even taking a walk in nature can lower cortisol levels. When your mind is calm, the parasympathetic system dominates, making it easier to get and stay erect. Maintain a healthy weight. Excess body fat, particularly around the belly, can increase estrogen levels and reduce testosterone. Shedding a few pounds through a mix of cardio exercise and strength training can have a noticeable impact on energy, mood, and sexual stamina. Setting the mood, environment, and mental state. While medications and health factors play major roles, don't underestimate the impact of setting. An intimate, comfortable environment helps keep stress levels low. If you're worried about noise, interruptions, or a lack of privacy, those concerns can quickly become distractions. Dim lighting, soft music, or even just ensuring you won't be interrupted can help you stay present in the moment. If you're experiencing relationship stress, perhaps from unresolved conflict or poor communication, this can also hamper your erection. The emotional tone between you and your partner carries significant weight. Sometimes, simply talking openly about worries or fears can clear the psychological hurdles that lead to performance issues. Addressing psychological contributors. Anxiety is one of the most common psychological factors leading to ED. Performance anxiety can trap you in a vicious cycle. Worrying about your erection can make you lose it, which fuels more worry next time. If this sounds familiar, cognitive behavioral therapy, CBT, or couples counseling could be helpful. A therapist can offer strategies to break the negative feedback loop, build confidence, and reshape the way you think about sexual performance. Moreover, unresolved emotional trauma, perhaps from a previous relationship, can linger in your subconscious. Confronting these feelings in a safe setting, possibly with the guidance of a mental health professional, allows you to process and release emotional baggage that might be affecting your intimate life. When to see a doctor. If you frequently lose an erection during sex, especially if it's becoming a consistent issue, don't brush it off. This could be a symptom of an underlying medical condition. According to the Mayo Clinic, you should seek professional advice if erectile problems persist for 2 or more months, become a source of distress, or if you notice other symptoms like a reduced libido or pain. A thorough evaluation may involve blood tests to check for diabetes, cholesterol levels, or hormone imbalances. Your doctor might also review your medications to see if they're contributing to ED. The goal is to get a complete picture of your overall health as well as your emotional well-being, so you can receive a treatment plan tailored to your specific needs. Conclusion. We've explored the multiple threads that weave into erectile function, from the finely tuned balance of the parasympathetic and sympathetic nervous systems to the ways chronic diseases, medications, stress, and lifestyle habits play critical roles. If you find that stress, health conditions like diabetes or hypertension, or specific medications are putting a damper on your intimate life, remember that solutions are available. Whether it's adjusting your medication, incorporating daily stress relief exercises, or seeking therapy for emotional triggers, there's hope and help for improving erectile function. Now, I'd love to hear from you. Which factor mentioned, stress, chronic disease, medication side effects, or lifestyle habits, has resonated with you or someone you know? Your experiences could be just what another viewer needs to hear. So don't hesitate to share your story in the comments. And if you found the information here helpful, please leave a like so that more people can benefit from these insights. If you haven't subscribed to our channel yet, I'd love for you to hit that subscribe button and tap the notification bell so you never miss our latest updates. Your support means the world to us. If you find this video helpful, please give it a thumbs up. It really helps share our message with a wider audience. I'm excited to hear your thoughts on today's topic. If you enjoyed the content, type yes in the comments below. If it didn't resonate with you, let me know by typing no. Your feedback is incredibly valuable and helps me craft videos that better suit your interests. Remember, your sexual health is an integral part of your overall well-being. With the right information, a little attention to lifestyle, and perhaps some professional guidance, you can navigate ED with confidence and reclaim a deeply satisfying, intimate experience. Here's to healthy living and a fulfilling sex life at every age. Disclaimer: this content is for informational and educational purposes only and does not substitute professional medical or mental health advice. Always consult with a healthcare provider for personalized guidance about your individual situation.